Studies have shown that there is no single cause of schizophrenia, as some of the neurotransmitters involved include dopamine. This hypothesis on why these neurotransmitters are important in schizophrenia is due to observations made regarding stimulant drugs such as amphetamine, and that they mimic the same kind of symptoms as schizophrenia. This is important to consider due to the social background and environment that many patients who use these drugs are in. These drugs may worsen a patient who is already at risk genetically and socially with the development of schizophrenia. All of the effective drugs that treat schizophrenia have dopamine involvement, and they all block dopamine D2 receptor. Dopamine dysregulation is at its worst when schizophrenia patients are very acutely ill and not on stable, predictable medication use. Understanding the importance of medication compliance with these patients is critical. One study stated that early treatment of schizophrenia is difficult due to the stigma about the diagnosis and the side effects, which include excessive tiredness and dozing off during mid-conversations and weight gain. These side effects could stop someone from taking medications. It can be difficult to have medication compliance when the patient is worried about things like brain fog, tiredness, and weight gain. These patients may require a very strong support network to ensure medication compliance. Additionally, other medications and lifestyle choices may be needed to help with these side effects. ChatGPT was very similar with the textbook and other resources in a few ways. ChatGPT did not show or mention the neurotransmitters involved or go into much depth about the genetic factors and social and environmental risks. These factors were mentioned, but they were just briefly mentioned. ChatGPT did a good job of outlining the main points and making it very easy to understand and reader-friendly. ChatGPT in this sense can help someone organize and outline main points of any research topic. It would be important, though, not to over-rely on ChatGPT or any other AI software, since often it only skims the surface on important factors such as cause, genetics, and neurotransmitters. Numerous studies have shown that patients with schizophrenia tend to have higher rates of comorbidities, such as rates of suicide, substance use disorder, and other conditions like obesity, lack of access to healthy lifestyle, and healthcare. The increase in substance use disorder and suicide is troubling and can be a very immediate concern regarding patients who do not take their medications. Often co-occurring mental health conditions or side effects are unrecognized and untreated. This can be alarming and concerning and can help explain further factors as to why many of these patients do not want to take their meds. Numerous studies have shown that when the medications are not taken at all, the risk of substance abuse and suicide is much more likely.